The second case that we're going to talk today about is Janet. So Janet came through to us through an email from a British audiologist who's been regularly performing ACT. But when they performed ACT with Janet, a prompt came up on the screen saying that the ACT stimulus wasn't clearly audible. Now, of course, the Audible Contrast Threshold test implies that the stimulus should be audible. So the real question from the audiologist was, should I continue this test at all?
It's a really important question because certainly we will see this message pop up from time to time. And it's important to know if, one, should we be performing the test, but if so, then how do we use that? So tell us more about Janet. What's her situation?
So Janet is a long-term hearing aid user. She started to lose her hearing in her mid-30s, and that's progressively got worse over the years. She's now 61, and the hearing loss is a severe to profound mixed hearing loss. Janet is very socially active. She loves sailing. Sailing is her complete life. She teaches at her local sailing club, and she also spends a lot of time with her grandchildren sailing. So hearing on the boat is essentially really important for her. She was seeing the audiologist today to have a reassessment in the hope to upgrade her hearing aid technology to try and hear a little bit more.
That sounds like a very challenging listening situation on the boat. So it'd be interesting to know more about what the audiologist found at that reassessment.
Yeah, so we can see the audiogram on screen here, and essentially it remains the same. So despite Janet having a progressive hearing loss up until her 60s, it is now nice and stable. Her tympanometry results are, again, clear type A tympanograms, and there was no obscurities on the otoscopic exam. So everything was looking nice and stable, just as we like it.
Okay, and what about when they performed ACT?
So with Janet, we need to understand why the prompt appeared on the screen in the first place. So with the ACT stimulus, what we know is that it has to be 15 dB sensation level in order for the test to start. What that means in Janet's case, if we look at her audiogram, she has this severe to profound hearing loss. And at the 4,000 hertz area, we can see that if we add 15 dB onto that stimulus, we're really going to be hitting the upper limit of the audiometer. So we're not going to be able to deliver that ACT stimulus at that correct intensity. That's why the prompt came up. The question then is, well, should we do it or should we not do it? With the ACT stimulus, what I recommend is that the bulk of the energy inside of it lives within the low frequencies all the way up into 2000 hertz. Again, looking at Janet's audiogram, we can see that we do achieve that 15 dB headroom with the audiometer's capability up to 2000 hertz. So in this case, I would proceed and do ACT because the bulk of the information is going to be audible to Janet. If you look for another patient and you saw that the severe to profound hearing loss was coming much more into the profound range and affecting the low frequencies, 2000 hertz and below, then I would then start to reconsider about the value of actually doing it. You can still do the test and look at the result, but it's really important to proceed with caution.
And so what ACT value did the clinician get for Janet?
So Janet had an ACT value of 6.5 dB NCL, and that puts her in the mild range. That's interesting because with Janet's hearing loss, you wouldn't expect her necessarily to have such a good hearing aid noise performance. What that means for Janet is that for her hearing aids, that this needs to be taken into consideration because she'll be able to understand and deal with speech cues much better than somebody who is struggling like Brad earlier on. With Janet, she had an automatic ACT implementation and she purchased the latest technology hearing aids. So unlike Brad, who we saw previously, Janet doesn't require us to go in and make those manual adjustments to the hearing aids. The hearing aids just take the ACT score and automatically implement that for her.
And so have you heard at all how Janet's getting on since having these changes implemented?
Well, I did follow up with the audiologist and they reported back that since being fitted and being programmed with the ACT score, Janet's really getting along with her new hearing aids, in particular in those sailing situations. So Janet's very happy with the technology.
That's really great to hear that Janet's getting on so well with her hearing aids now. And so with cases similar to Janet's, where we are looking at quite a severe to profound hearing loss, have you got any advice on when we would or maybe wouldn't trust the ACT score so well?
Yeah, it's a really good question. And we are sort of walking into a gray zone. So, as I mentioned before, prior to doing the test, look at which frequencies are impacted and which have that 15 dB of headroom. If you continue to do the ACT test anyway, and then it's really important to look at the scores itself, which you're obtaining. If you're getting a super high ACT score in the severe range, then you don't necessarily know if that's an audibility issue or a hearing and noise issue. You can't separate the two because we don't quite have or understand the audibility of the stimulus. And that's why that prompt is so important to have on the screen. However, if you are seeing a low ACT score like Janet, and but maybe more of the audiogram didn't have quite the audibility that Janet has, but still showing a low level, then this actually is very good information because it tells us that this person is able to hear well in noise or deal with speech and noise cues well.